First we'll talk about the access group of antibiotics. Clear? Access group of antibiotics. Now this basically includes antibiotics that have activity against a wide range of commonly encountered susceptible pathogens, while also showing lower resistance potential. First criteria, wide range. Second criteria, lower resistance potential than antibiotics in the other groups. Clear so far? Great. Now selected access group antibiotics, they are recommended as essential first or second choice empiric therapy. Like I told you, empiric means based on the previous experience. For infectious syndromes reviewed by essential medicine list expert committee, and they are listed as individual medicines on the model lists to improve access and promote appropriate use. These are essential antibiotics and they should be easily available, affordable, like at a good cheap rate. They should be quality assured. So what are the three important parameters that we have to remember here? First of all, easy availability. That's the first. Then second, they should be cheap or easily affordable. And number three, quality assurance, QA. That should be a must. Okay. Now talking about certain access group antibiotics, which are first, I'll be starting off with amoxicillin. Amoxicillin is the first choice antibiotic in community acquired pneumonia. This can be mild, it can be moderate, and it can be severe. Fine. Then it can be a first choice drug in complicated, severe, acute malnutrition. Then exacerbations of chronic obstructive pulmonary disease. Clear? Then it can be used in the treatment of, first line as in the treatment of otitis media, infection of the middle ear, otitis inflammation, media, middle ear. Clear? Then infection of the pharynx known as pharyngitis. Then progressive apical dental abscess. It can be written as COPE or COP. You have a lot of C's here, right? Coping mechanisms, COPE. Okay. Then progressive apical dental abscess. Then if the coping mechanisms fail, what happens? You have sepsis in neonates and children. Sepsis in neonates. What is the difference between a neonate and a child? Please let me know in the comment section. Sepsis in neonates and children. Then sinusitis. Finally, we have uncomplicated severe. That was complicated severe acute malnutrition. It can also be used in uncomplicated severe acute malnutrition. I hope I'm clear so far. So this is the first choice. Then amoxicillin can be used as a second choice drug in the treatment of acute bacterial meningitis. So now talking about other medicines in the same group, like we have amikacin, which is an aminoglycoside. So this is basically the first choice of drugs in the case of high risk febrile neutropenia. Yeah, I'm sure you are very well acquainted with this condition. High risk febrile neutropenia, and also in pyelonephritis, that is, you know what is pyelonephritis, or prostatitis, it is severe. Okay, and amikacin is a second choice drug in the case of sepsis in neonates as well as in children. Sepsis in neonates and children. Clear? Great. Now talking about a combination, that is co-amoxiclav, which is a combination of amoxicillin and clavulanic acid. Clavulanic acid, all of you are well aware, it is a beta-lactamase inhibitor. Others among that are sulbactam, tazobactam. So it is a first choice drug. In which conditions? Very important. Community acquired pneumonia severe, then complicated intra-abdominal infections. These can be either mild or they can be moderate, mild to moderate. There's different gradings. Then exacerbations of chronic obstructive pulmonary disease, hospital acquired pneumonia, then low risk. Yeah, the difference you need to tell me in the comment section. What is the difference between low risk and high risk febrile neutropenia? Then number 6, lower, there is upper urinary tract infection and lower urinary tract infection. So this is the first choice in lower urinary tract infections. Sinusitis, we have all the sinuses here, the frontal sinus, the ethmoid sinus, the sphenoid sinus, okay, the maxillary sinus. Clear? And it is also the first line drug in skin and soft tissue infections. Okay, great. Now this is the second choice in which of the following drugs, which of the following conditions. Yeah, I just missed it. Second choice in bone and joint infections, bone plus joint infections. Then it is in community acquired pneumonia, mild to moderate. Can be severe also. Yeah, mild, moderate, severe. Then otitis media, I told you, infection of the middle ear. And finally, in the case of surgical prophylaxis. Okay, then talking about a few more of them, like I'll be talking about ampicillin. Like it has cillin. I told you if any antibiotic have a suffix cillin, it is a penicillin, like ampicillin. This is the first choice drug in the case of community acquired pneumonia severe. Then second and complicated intra-abdominal infections. Then complicated severe acute malnutrition. Then sepsis in neonates and children. Then it is a second choice drug in the case of acute bacterial meningitis. You have seen there is a common correlation between amoxicillin and ampicillin among the indications. Yeah, I'm glad you are able to appreciate that. But here you have all C's, like there you have to cope up with certain mechanisms. If you don't cope up with those mechanisms, you can develop sepsis. Okay, great. Then talking about another drug, now we have stopped with A, starting with B. B is benzathine, benzyl penicillin. Benzathine, benzyl penicillin. Okay, first choice obviously syphilis. You can't forget this ever. Like the first choice, syphilis. So the most commonly asked question of benzathine, benzyl penicillin. Then another, this is basically added to make it longer acting. Benzathine group is added to benzyl penicillin to make it longer acting. Then in benzyl penicillin, the first choice is severe community acquired pneumonia, complicated severe acute malnutrition, then sepsis in neonates and children, and to some extent syphilis. Meaning I'm saying to some extent because drug of choice without doubt, undoubtedly in syphilis is benzathine, because it is a very long acting drug. Maybe we can use this also. Coming on to the second choice, we have same here, acute bacterial meningitis. Then moving on to C. With C we have a cephalosporin by the name of cephalexin. Now in some textbooks this is written as cephalexin. Okay, both are correct. Depends. So first choice in skin and soft tissue infections. Then second choice in COPD, chronic obstructive pulmonary disease exacerbation, and also in the case of pharyngitis, that is inflammation of the pharynx. Clear so far? Great. Then we have another antibiotic by the name of cefazolin. Cefazolin, very important, most commonly asked question. It is the first choice drug in the case of surgical prophylaxis. First choice drug in the case of surgical prophylaxis, goes without saying. Second choice drug, it is in the case of bone and joint infections. Bone and joint infections. Then moving on to the third category, that is chloramphenicol. This is basically a second choice drug in the treatment of acute bacterial meningitis. Clear so far? Great. Then moving on to other medicines starting with C, like clindamycin is one of the very commonly used antibiotics, and this is a favorite question, where is it the first choice? So you need to remember this thoroughly. It is in the case of necrotizing fasciitis. Second choice in bone and joint infection. Second choice in bone and joint infections. Then cloxacillin, first choice drug in the case of, but we generally prefer dicloxacillin and flucloxacillin because of oral administration. Cloxacillin, meaning, I just tell you one important thing, that cloxacillin like DCF, dicloxacillin, cloxacillin, flucloxacillin, they are preferred for oral administration due to better bioavailability. I'm sure all of you are well acquainted with this term. Please define it for me in the YouTube comment section. Then first choice in bone and joint infections. Bone and joint infections, also first choice in skin and soft tissue infections. Okay, then it is the second choice in sepsis in neonates and children. Sepsis in neonates and children. Then moving on to D. Okay, the next letter, that is for D we will use doxycycline. Now this is very important because this is a very commonly asked question, that doxycycline is the first choice drug in what? So just simple answers: cholera and two C's, like CD, compact disc. In our days there was a compact disc, we used to play films on that, music on that. C for cholera, and another C is sexually transmitted infection due to chlamydia trachomatis. Sexually transmitted infection due to chlamydia trachomatis, or better said as chlamydiasis. Okay, then second choice drug also in some cases it is cholera, then community acquired pneumonia, mild to moderate, and exacerbations of COPD. Like here also lots of C's are there, so just remember that wherever there are lots of C's, it can be a compact disc, exacerbation of COPD. Then moving on to gentamicin, which is again an aminoglycoside. First choice, very important in acute bacterial meningitis in neonates. Community acquired pneumonia severe, complicated intra-abdominal infections, complicated severe acute malnutrition, and last but not the least, sepsis in neonates and children. Yeah, tell me the difference between neonates and fetus. Then it is used as a second choice drug in the treatment of gonorrhea, which is again a sexually transmitted disease, as well as it can also be used as a surgical prophylactic. Now moving on to other drugs in this class, metronidazole, commonly known as a brand name Metrogel, it is sold, metronidazole. So this is the first choice in the case of Clostridium difficile infection. Clostridium difficile infection, like it causes pseudomembranous enterocolitis, then complicated intra-abdominal infections, mild to moderate, like all complicated intra-abdominal, all mild, moderate, and severe. Fine. Then necrotizing fasciitis. You all are well acquainted with these terms. Necrotizing fasciitis, surgical prophylaxis, and also in trichomoniasis. You know trichomoniasis. Okay, then this is a second choice in complicated intra-abdominal infections, mild to moderate. Then moving on to nitrofurantoin. Here it is the first choice in lower urinary tract infection. You need to tell me in the comment section what is the difference between lower and upper UTIs. Then another drug here important, it is phenoxymethyl penicillin. So it is the first choice in community acquired pneumonia, mild to moderate. Pharyngitis, and also it is used in the treatment of progressive apical dental abscess. Then moving on to procaine benzyl penicillin. Now this is not recommended as a first line treatment for neonatal sepsis except in settings with high neonatal mortality. When given by trained health workers in cases where hospital care is not achievable. First choice, congenital syphilis. Yeah, you know the difference. I'm sure you have studied it in medicine. However, the second choice in syphilis. Now talking about one very important antibiotic, the name of which starts with S. Yes, you guessed it right. It is pectinomycin. This is basically a second choice for gonorrhea. So concluding the access group of antibiotics with two very important drugs. First is cotrimoxazole, which is all of you know, very good, excellent. Combination of trimethoprim and sulfamethoxazole. So this is the first choice in the case of lower urinary tract infection, and it's a second choice drug in the case of acute invasive diarrhea or bacterial dysentery. Okay, fine. Then moving on to trimethoprim. This is the last medicine in the access group. So trimethoprim is the first choice in. Yes, very good, excellent. If you have answered, I really applaud you. It's commendable. It is the first choice drug in the case of lower UTI. So this finishes the access group of antibiotics.